Mr. President, I want to thank our leader and thank Senator Casey for introducing and pushing to pass this very important legislation. This legislation, which I was proud to be an early sponsor of, the Protecting Our Infants Act, which will help address the increasing number of newborns born with opioid dependency. I also want to thank all of the additional members, including the chairman of the HELP Committee and Ranking Member Murray, for helping get that through that important committee. New Hampshire is facing a public health epidemic. In fact, the heroin and prescription drug addiction crisis is the single most urgent issue facing my state right now. So many families have come to me, Mr. President, who have lost children. The other day I was buying something and the woman behind the counter said to me, "Keep working on this issue." And I asked her why, and she said, "I lost my granddaughter." Too many families are experiencing losing their loved ones. There's family members struggling with addiction. Our first responders inundated. They're saving lives with life-saving drugs like Narcan. Public health and safety officials in our state, this is truly something that we all need to work together on to address. But one of the tragic results of this growing opioid abuse epidemic, and it's often been overlooked, is the increasing number of infants that are born dependent on opioids and suffering from withdrawal. In fact, researchers have found that they estimate almost every hour in this country, Mr. President, there is an infant being born who is suffering from withdrawal symptoms or born with dependency symptoms from opioid addiction. This is an issue that I'm so glad we're being addressed in this bill, the Protecting Our Infants Act. How we treat our children and our infants is so much a reflection of who we are. That's why I was proud to co-sponsor this bipartisan legislation, which will call for the development of recommendations to prevent and treat prenatal opioid use, including neonatal abstinence syndrome. This bill would also ask the Centers for Disease Control and Prevention to assist states in data collection and increased surveillance to better monitor the prevalence and causes of neonatal abstinence syndrome so that we can work on more support for, in my view, prevention, treatment, recovery, to help mothers get the support and get into treatment. So obviously we don't have infants that are born with opioid dependence and withdrawal symptoms. Across the nation, as the leader said, the number of infants diagnosed with newborn withdrawal has increased 300% since 2000. In my home state of New Hampshire in May of this year, I actually visited the Catholic Medical Center in Manchester and heard directly from medical personnel there and first responders who have been treating and responding to cases of newborn withdrawal. Catholic Medical Center officials reported that 7% of newborn babies were born at that hospital with neonatal abstinence syndrome, a significant increase from last year. And according to officials at Catholic Medical Center's Pregnancy Care Center, close to half of the mothers cared for are struggling with addiction. So I again want to thank the leader. I want to thank Senator Casey. Today's passage of Protecting Our Infants Act is one very important step to address the crisis of opioid abuse seen in New Hampshire and across this country. But I would also, urge, now that we've passed this in the Senate, I want to thank those members in the House that have led this effort. I hope the House quickly passes this and sends it to the President of the United States. But I also hope that the Senate will continue to focus on this public health epidemic, because there are many solutions that are bipartisan. One is called the Comprehensive Addiction and Recovery Act. This is a bill that I helped introduce with Senators Whitehouse, Portman, and Klobuchar. And this is a bill that will deal with prevention so that we can make sure that we get that message out to prevent people from overusing and misusing prescription drugs and also turning to heroin, so that we can have more support for treatment and recovery where there's a big gap in my state, that we can support our first responders to make sure that they have access to the life-saving drug Narcan. And one of the experiences I had recently is that I went on a ride-along with our largest police department, and I had previously gone on a ride-along with our largest fire department. Within a half hour of the fire department ride-along, we went to a heroin overdose. I watched the emergency personnel, police, fire, emergency first responders bring someone back to life using Narcan. When I did the police ride-along, within an hour and a half, we went to 2 heroin overdoses, and again, first responders saved those 2 individuals' life. But I gotta tell you, I was a murder prosecutor. I've seen a lot of tough things when I was Attorney General. But I couldn't breathe when I was sitting in that room and I watched that second individual, young man on the ground, first responders doing everything they could, another dose of Narcan, and I thought he was gone. And this is what our first responders are dealing with every single day.
Would the senator yield for a question?
Yes.
You know, I naively thought my state was uniquely afflicted with this scourge. Had the drug czar come down to Kentucky, particularly the northern Kentucky part of my state, which is a suburb of Cincinnati, only to find that it's a problem all over the country. And I was curious as to how this rates with the people of New Hampshire as one of the things they're concerned about.
Well, Leader, I will tell you, I had Director Botticelli came to New Hampshire as well, and he testified at a field hearing that Senator Shaheen and I had in New Hampshire. And for the people of New Hampshire right now, this is a crisis. It's a public health epidemic. I think I did a town hall last night, and the single biggest question I got asked about was this, because I believe this is one of the top issues, if not the top issue, on the minds of people in New Hampshire, because they see their friends and family being impacted by this. And this is every socioeconomic group that's being impacted by, unfortunately, prescription drugs, and then heroin, which is so cheap on our streets right now, also sometimes mixed with a deadly drug called fentanyl. In fact, Mr. Leader, we had a 300% dramatic increase, a 60% increase in drug deaths, but 320 drug deaths last year.
Yeah, we're losing more to drug overdoses now than we are heroin overdoses than we're losing in car accidents. Is that true in New Hampshire?
It's the exact same thing in New Hampshire. More people are dying from heroin, fentanyl, and abuse of prescription drugs than car accidents, which is staggering when you think about it in our state. And so this is a national epidemic, and that's why I appreciate the bill that was passed today. But I think that there's more that we could do in this body that would benefit the nation, would benefit our states of Kentucky and New Hampshire, to help give tools to the first responders, the public health officials, treatment providers, those supporting recovery and helping prevent this in the first instance in this body. And it's something that would obviously help address this crisis, but also something that is a public health issue that we should all care about.
Well, I just want to thank the Senator from New Hampshire for her outstanding work on this really important issue, and I have a feeling we're going to be grappling with this in all of its various forms for many years to come.
Well, I want to thank the leader for this bill today, which is, I'm glad we're passed, and I look forward to working on additional legislation. Thank you, Mr. President. I yield the floor.